Travel.
Okay, so welcome everyone to the CVES and endocrine lecture for Friday. Thank you so much for joining the class. Hope you guys are doing well. If you guys can hear my voice, can I get a yes in the chat box, please? Yes, okay. We apologize for starting the class a little bit later than our regular schedule, but today we have an exam, so there's nothing to be worried about. We will get done with the exam and then we'll talk a little bit more about the text in first aid. That's that. Another thing that we apologize for is for the mistake of writing step 2 CVS instead of step 1 CVS. So that's another thing. I hope you guys did not get confused. And if you did, I am very sorry. So with that being said, thank you so much. And are we ready to start the exam for today? Yes or no? Yes. Okay, good. Did you guys get some time to revise the text in first aid from yesterday? Some. Okay. So this is what we're going to do today. We are going to begin the exam and we'll do it in 2 parts. So the first part, we'll do 20 questions now, and then after that, we'll do 20 questions towards the end of the lecture. Are we clear? Yes or no? Okay. So the first part that we will do is that we will do cardiovascular system. And then for the second one, we will do endocrine system. So that's that. Just give me 1 second to begin. Okay, so we will be giving the exam on physiology, endocrinology, and anatomy for the cardiovascular system. I do not want to include pathology right now since we're not done with pathology. So that's about it. Is everyone ready? So as usual, you guys will get 1 minute and 30 seconds for each question. And after 1 minute and 30 seconds, we will change the, we will change the question and then we'll move to another one. Okay, So can we begin now? Yes or no? Thank you. So Dr. Evan is ready. How about the rest of the students? Okay, so Dr. Hagar is ready. Who else? Who else is ready? Okay, Dr. Fidel is ready. Okay, Dr. Tasneem, Dr. Nur Mohammed, thank you so much. The majority of the students are ready, so let's begin. Your time starts now. Okay, can you guys hear my voice? Yes or no? Can you guys hear my voice? Yes. Okay, good. So for this question, exactly at 1 minute, I will show you the graph. Okay. Exactly at 1 minute, I will show you the graph. Did everyone understand what I'm trying to say? I will expand the graph and I'll show you the graph. Okay. Are we ready? Okay, so we are done with the timing. Okay, your half an hour is over for 20 questions. Thank you so much for putting your utmost attention in the questions. Did everyone get a fair chance to look at each question, yes or no? Yes, okay. Does anyone want to review any other question before I start solving the questions? Does anyone want to review any question? If yes, good. If no, then can I please get a no in the chat box, please? So that I know that you guys are okay. 16. Okay, let's start with 16. Very quickly, I'm going to give you 1 minute. Please go through the text, Dr. BK, and then I'll move forward. Does anyone else want to go through any other question? $19. Okay. Okay, number 10. Okay, is everyone done? Yes or no? Is everyone done? Yes. Okay, so let's begin. Now, let's ask you guys over here about the question patterns. Did it match our discussion with the first stage? Yes or no? Yes? Okay. How do you guys feel about the questions? Do you think that it was easy, not easy? How was it? Okay, so the questions were fair. Okay, so let's begin with the first one. Moderate. Oh, no problem. So let's begin. So please write down whether your answer is the right one or not the right one. And let's start with the first one. A 32-year-old woman comes to the physician for a health exam, scuba diving. Following a deep inspiration, she is instructed to forcefully exhale against a closed airway and contract her abdominal muscle. Which maneuver are they describing over here? Can anyone tell me what is the name of this maneuver? Valsalva maneuver, very good. Okay. Which of the following effect is most likely after 10 seconds in this position? The answer for this one is decreased left ventricular stroke volume. Okay, very good, Dr. Ellen. Good job. And anyone else who chose D, very good. Okay. Decreased left ventricular stroke volume, that makes sense because when you have increased Valsalva maneuver, which load is increased, preload or afterload? Fast answers, please. Especially during the sustained straining phase. There is increase of preload or afterload? Fast answers, please. Increase of afterload, very good, not preload, increase of afterload. If afterload is increased, then stroke volume is decreased. Do you guys remember this from our discussion in physiology? Yes, let's move forward. Which of the following is the most likely effect of this drug? The drug works by selectively inhibiting the influx of sodium into the cardiac myocytes at high dose. Do you remember yesterday, or when I talked about the membrane potentials, I told you that it's important to know the concept because of what? Drugs or disease? The answer was, it was because of drugs, right? So this is an example of the discussion that I had. Do you guys remember that? Do you guys remember the fact that I told you that the membrane potential questions are going to be related to drugs? Yes or no? Okay. So make sure that you guys make sure that you guys remember the physiology. And over here, the drug is increased of oxygen efficiency. This was a pretty difficult question. The reason being is because, yes, ranolazine, right? Ranolazine. So we'll talk about this drug in pharmacology, CVS pharmacology over here. But over here, the drug, they work by inhibiting the late influx of sodium channels into the cardiac myocytes. So what does this mean? If there's a late influx of the sodium channel into the cardiac myocytes, for example, we know that, do you guys remember from the resting membrane potential, there was an influx of sodium that resulted in the huge rise, in the steep rise, yes or no? Something like this. Okay. Give me 1 second. Do you guys remember this discussion of ours? That it was at resting membrane over here, then there was a strong rise like this. And then it looked something like this, right? So over here, if there is a late influx of sodium channel, what would happen to the depolarization? Will it be slowed down? Yes or no? Last answers, please. Yes, if it's slowed down, will the ventricular muscles, will they contract more? Will they contract more or contract less? The answer is they'll contract less. If they contract less, do they have enough time for increasing oxygen consumption? Yes or no? The answer is yes. Okay. So that's basically what they're trying to tell you. Increase of oxygen efficiency. Increased oxygen efficiency means more time available to use the oxygen. Okay. So this was a pretty, I would say that it was a pretty difficult and a tricky question over here, because not only this, a lot of students also chose increased parasympathetic tone. And that was because they thought that the drug was a parasympathetic drug, because parasympathetic drugs also decreases your sodium influx. Okay. So if you have missed out on this, no problem. Let's move forward. Which one did you guys choose for this one? Fast answers, please. A genetic analysis reveals a mutation in the KCNQ1. Do you remember I talked about Jarvel and Lange-Nielsen syndrome and Romano-Ward syndrome? Yes or no? And Romano-Ward syndrome? Yes? Okay. So this patient has bilateral sensory neural deafness. Which one do you guys think the answer is? The answer for this one is F, prolongation of QT interval. I distinctly remember talking about this. Do you guys remember? Okay. I hope you guys chose the right answer for this. Let's move forward. This one, which one did you guys choose? Which of the following pressure volume loops is most likely to correspond to the patient's cardiac condition? Which one did you guys choose from over here? So there's an opening snap. This means that this patient has mitral stenosis. So which one did you guys choose? The answer is D. Does it go very well with our discussion of the pressure volume loops? Yes or no? Yes, very good. Okay, thank you so much. And I'm really proud of you guys for remembering the information. Let's move forward. Which of the following is the most likely etiology of the patient's lower extremity edema? Okay, which one did you guys choose from over here? Patient has a wide split S2. Okay, and ECG shows right bundle branch block. Okay, this one, the answer is very good. Really proud of you guys. D. Okay, increased capillary hydrostatic pressure. Good job. Let's move forward. Which of the following is most likely decrease in patient's response to his hematemesis? Okay, what is hematemesis? Is it bloody vomiting, bloody diarrhea, or what is hematemesis? Fast answers, please. Of course, right? It's bloody vomiting. Okay, so which one did you guys choose? Let's see if it goes with your answer option. The answer is, if you have bloody vomiting, then what would happen? You would lose out on your blood volume, and as a result, the cardiac baroreceptor firing activity. Now, my next question is, will there be increased activity or decreased activity? Fast answer, please. There will be increased activity, very good. Decreased activity. If you lose blood volume, then there's decreased activity, okay? Because if there was increased blood volume, would it increase the stretching of the receptor, yes or no? The answer is yes. So since there is decreased blood volume and decreased blood pressure, this would result in decreased Carotid baroreceptor firing activity. Okay, let's move forward. Next one, the drug is most likely a derivative of which of the following hormones? Which one did you guys choose? Okay, guanylate cyclase activity. Okay, this is BNP. Do you guys remember I talked about the fact how you will receive questions? You will receive questions regarding the second messenger system, yes or no? Flat champ, then BNP, ANP, nitric oxide, right? And all of those ones. Do you guys remember the paragraph? Okay, let's move forward. Which of the following ion channels is most likely targeted by this drug? Okay, which one did you guys choose? The answer is very good. Voltage gated potassium channel. Patient has, yes, very good. Okay, so congratulations. C is the correct answer for this one. Let's move forward. It's a pretty direct question. Let's move forward to this one. Which of the following is most likely to result at earlier onset of this patient's auscultation findings? Okay, so which one did you guys choose for this one? Abnormal joint hypermobility. Okay, very good. This one is abrupt standing. What happens in abrupt standing? First and foremost, what does this patient have? This patient has a mitral valve prolapse. Okay, do you remember from the first aid that you guys read that HOCM and mitral valve prolapse, they have the same maneuver murmur intensity? Yes or no? They have the same maneuver murmur intensity. Okay. So if you stand abruptly, does the blood go to your peripheral blood vessels? Yes or no? The answer is yes. If the blood goes away from the peripheral blood vessels, then is there a lot of blood in the heart or is there less blood in the heart? Fast answers, please. There's less blood in the heart. If there's less blood in the heart, then there should be increase of two murmurs. One is HOCM, another one is mitral valve prolapse. Okay. If you guys have difficulty understanding this, then please, I would ask you to refer to the table in first aid where they have this. Do you want me to show that table now, or do you guys remember what I'm talking about? Fast answers, please. Do you remember what I'm talking about, or do you want me to show the table? So let me show you the table. Do you guys remember that I asked you to go through the table of the murmurs and maneuvers? Yes or no? Yes, over there, do you remember that there are some murmurs that will increase with blood and decrease with blood? And when I told you that the murmurs that will decrease with blood in the heart is HOCM and mitral valve prolapse. Okay, let me see. This is the one I'm talking about. 1 second. This one. Do you see how mitral valve prolapse and HOCM, they're the same? So that's how you have to make your conclusion. Okay. Let's move forward to the next question. Which one did you guys choose for this one? Plopping sound followed by a low pitched. Okay. There's a plopping sound. No one makes a plopping sound except a cardiac tumor, especially a cardiac myxoma. Okay. A cardiac myxoma will always make a plopping sound. Okay. Can anyone tell me in which side of the heart do we usually get a cardiac myxoma? In which chamber? Left or right atrium or left or right ventricle? The answer is not left ventricle. Left atrium is the correct answer. The answer is it's usually in the left atrium. Okay. So plopping sound, mid-diastolic murmur. This is a cardiac myxoma. Let me show you a picture of this. Okay. This is how the cardiac myxoma will usually look like in the left atrium. Okay, and this will obstruct the, excuse me, this will obstruct the blood flow. Okay, let's move forward. Which one did you guys choose for this one? Yes or no? Okay, so let's begin. This is very good. end diastolic pressure, Dr. Ethar, very good choice. A decrease of which of the following is the most likely explanation for the improvement of this patient's chest pain? The answer is end diastolic pressure. Since that increased, then so the patients, they basically have less blood available in the left ventricle. And this has basically, this is basically the thing, because nitroglycerin will increase your preload. Do you remember? Yes or no? Nitroglycerin will increase your preload, and it will also increase the coronary artery blood supply. My apologies. It will decrease the preload and it will increase the coronary artery blood supply. Okay. So that's why, since nitroglycerin decreases the preload, that's why the end diastolic volume is decreased and the end diastolic pressure is also decreased. Are we clear? Can we move forward to the next question? Okay. Nitroglycerin decreases preload. My apologies. Decreases preload. Okay, not increases preload. Please remember that. Let's move forward. Which of the following conditions is caused by a failure of an embryological process similar to that responsible of the heart's condition? Which one of this is the correct answer? We know that over here. Okay, the answer for this one is F, hypospadias. Okay, because hypospadias is the failure of the urethral folds to fuse, and then the same way we have the failure of fusion of the ostium primum and the ostium secundum. As a result, the patient has a patent foramen ovale. So since both of them are a problem with failure of fusion, that's why hypospadias, the pathology of hypospadias, that is failure to fuse, and the pathology of a patent foramen ovale, that is the failure of fuse of the ostium secundum and the primum, is the same thing. Okay. That's that. Paraglossal duct cyst. The answer option is not paraglossal duct cyst, because this is obliteration. This is obliteration. This is failure of fusion. For example, Hirschsprung disease would be failure of migration. Okay, look, failure of migration. That's that. Transposition of great vessels would be failure of formation. Failure of formation and spiraling of this one. Midgut volvulus. Which one would this be? This one would be failure of development. So that's it. So there are different broad spectrum terms. This one is also failure of the apoptosis. So that's that. So basically different embryological diseases happens because of different pathologies. So since this one matches with the one of the patent foramen ovale, hypospadias is the correct answer. Are we clear? Yes or no? Do you understand how the questions are basically coming? They are testing your concept. Okay, so your concept has to be very clear. Let's move forward. Which of the following directions of blood flow would most likely confirm the diagnosis? Which one did you guys choose? Okay, very good choice. B. Okay, so this is a pretty direct, straightforward question. I'm not going to explain this. If you guys need me to explain this, let me know. Should I explain this question or should I move forward? Fast answers, please. Let's move forward. Okay, which of the following is the most likely direct effect of these metabolites? Do you remember that I talked about the metabolites, yes or no, that in the heart muscle, there are a certain amount of metabolites that will dictate blood flow. So over here, this is decreased systemic vascular resistance. Increased concentrations of adenosine and lactate will increase blood flow. In order for blood flow to increase, systemic vascular resistance has to be low, right? So that's it. Are we clear? Let's move forward. To stop the bleeding, the artery is ligated. Which of the following is the likely origin of the arteries? Okay. Do you remember this? We talked about this in the first day. The first day we talked about this. This is external carotid artery. Very good. Really proud of you guys over here, because we talked about this in the first day and you guys remember the information. External carotid artery is the superior carotid artery is a branch of the external carotid artery. And can anyone tell me which one is internal carotid or inferior thyroid coming from? Inferior thyroid, they come from the subclavian artery. Yes? Okay, very good. This one. Which of the following additional values is sufficient to calculate the cardiac output? Which one did you guys choose? Very good. Do you remember the Fick's principle? Fick's principle, arterial oxygen minus venous oxygen divided by arterial oxygen saturation. Yes, according to the Fick's principle. So that's that. Okay, we talked about this. Remember, I told you that there are two equations for cardiac output. One is stroke volume times heart rate. Another one is the Fick's principle equation. Okay. Next one is this one. Which of the following is the most likely cause of the patient's symptoms? Doesn't this look like a boot? Yes or no? A boot in the heart. Okay. This is tetralogy of Fallot. Very good. Really proud of you guys. Good job. Very good. Let's move forward. Echocardiogram is most likely to show which of the following? Can anyone tell me the correct answer for this? Okay. This is persistent blood flow between the pulmonary artery and descending aorta. Okay, so everyone who chose C, very good job. Why? Let's see why we have persistent blood flow. Over here, what are the positive findings? He has always been tired and then lethargic. Do you remember yesterday I told you patients will come to you with fatigue, lethargy, and all of these things. And room air shows an oxygen saturation of 96%, and extremities are synchronous bilateral, and the radial pulses are bounding. So bounding radial pulses and bluish discoloration and bulbous enlargement of the distal toes. I want to talk about this over here very quickly. Before I do this, we need to know that over here, echocardiogram is most likely to show which of the following. The answer for this one is that these sorts of patients who will come to you will have a continuous machine-like murmur. This is your diagnosis for PDA, persistent ductus arteriosus. Okay, very quickly, I just want to explain one thing to you guys. Does anyone know the mechanism? I mean, the pathology of clubbing. Why do we get clubbing? Not the kind of clubbing where we go out at 11 a.m. and wait for the DJ to come out so that we can start dancing and partying. Not that kind of a clubbing. What kind of a clubbing am I talking about? Does anyone know what kind of clubbing I'm talking about? Very good. Okay. This is clubbing, the formation of drumstick fingers. Okay. Does anyone know why we get clubbing? The reason why we get clubbing is because in cases of a lung disease, okay, or in cases of a heart disease, we usually suffer from systemic hypoxia. Yes or no? We usually suffer from systemic hypoxia. Now, the thing is, in the entire blood circulation in the body, they're carrying low amount of oxygen in terms of heart disease and lung disease. But when the low blood flow, when the blood with low oxygen goes to your nail beds, right? To your nail beds, the nail beds, they have a very distinctive features of secreting growth factors in response to low oxygen. Okay, especially they release platelet-derived growth factors and fibroblast growth factors. These growth factors, they increase the growth of the matrix and the connective tissue in the nail bed, and this causes your drumstick fingers. The nails, they appear like this. Okay, so that's that. Wait one second. Over here, you will not get this angle. There's this angle that usually forms between the nails and the finger over here. So this is usually absent. So you'll find something like this. Okay, so you find something like this. Okay, this is called clubbing. Let me show you a picture of clubbing. Okay, are we clear? Yes or no? Let's move forward. Okay, this is actually not a very difficult question. I'm going to tell you why. Which of the following values most likely represents the area of the stenotic valve? Over here, let's talk about the fact that it shows a decrescendo systolic murmur. The area of the left ventricle is this, using a cardiac Doppler. Which one is the correct answer? The correct answer for this one is over here. Let me tell you what the reason is. So the reason for this one is, for example, we know that over here, okay, let me talk about this. This concept is expressed mathematically by the continuity equation, that is A1V1 equals to A2V2 through the left ventricular outflow tract, and subscribe 2 denotes blood flow through the aortic valve. The velocity in the left ventricle is 1, while its area is 1, as the velocity of the aortic valve was measured to be this. So basically what they're trying to tell you is that, one second. So what are we seeing over here? What we're seeing over here, that what is the amount that we get for let me just show you over here. Okay. Flow is area times volume, right? So if there is a stenosis, or some sort of valvular defect or something, or for example, this is the interatrial portion. What if I talk about valves? In the valves, something like this. So we have to calculate the flow. So basically flow, shouldn't the flow be equal, the blood flow? Shouldn't the blood flow be equal in all the chambers? Yes or no? 1, 2, 3, 4, meaning that the blood should flow in the same way that it is basically flowing in all the chambers. So depending on this, we have our equation, that is flow in this chamber and flow in this chamber is equal. So if this is chamber 1 and this is chamber 2, then A1 V1 equals to A2 V2. So from the text, we know that A1 is 1, V1 is 30. And over here, the answer, this was 3, right? So the answer is, this is the area that we do not know, but we know the volume, that is 3. So the answer is 30 divided by 3 equals to A2. So the answer is 10. Okay, so if you guys could not answer this question, that's completely understandable, because we did not discuss this in first aid. This is an extra information. And as a matter of fact, this is a completely new question. We have not received this question. Myself as a tutor, I have not received this question before, but I was familiar with the concept. So that's why it was easy for me to describe this for you guys. So if you guys could not answer this, that's completely okay. But is there something new to learn from? Yes or no? Is there something new to learn from this question? The answer is yes. Okay, so that's the thing. So please do not be disheartened if you could not answer this. That's completely okay. Let's move forward. But did you guys understand this question? Yes or no? Okay, let's move forward to this one. The substance responsible for bradykinin breakdown is primarily produced by which one? Very good. Pulmonary endothelium. Yes, we know that. Pulmonary endothelium secretes ACE, angiotensin converting enzymes. Let me tell you, if ACE is responsible for breaking down bradykinin, in ACE inhibitor, do we get high amount of bradykinin? Yes or no? The answer is yes. As a result, do patients suffer from dry cough? Yes or no? The answer is yes. No. So how many did you guys get right? How many did you guys get wrong? Okay. The answer is, if you have scored anything close to 10 out of 20, then you pass. So who are the students who passed? Dr. VK, congratulations. Who else? Dr. Tasneem, congratulations. Dr. Ethar, congratulations. Dr. S, Dr. Ellen, Dr. Dahlia, congratulations. Dr. Sanjeeva Chaudhary, thank you so much. Congratulations. Who else? Okay, so the rest of the students, if you have not passed, then let me tell you, then it's a bigger congratulations for you. I'm going to tell you why. Because Dr. Sanjeeva, Dr. Ellen, Dr. Dahlia, Dr. S, Dr. Ethar, and Dr. Tasneem, and who else, and whoever has passed, they will not, most probably, they will not go through the text today. Okay, because they know that they are satisfied, they have passed the exam, and they're going to move forward. But the students who have not passed the exam, I know what you guys will do. You guys will go through the text one more time. Okay, I know that for a fact. You guys will go through the text one more time. And at the end of the day, when you guys go through the text one more time, next week, when we have another exam, you guys will have a better result, okay? So please prove me right. Go through the text one more time, and next week, we will see that you guys will have a better result. Please do not be disheartened, okay? I actually feel bad for the students who passed the exams, okay? I wish I was one of the students who failed the exam so that I would go through the text one more time. Okay, so that's that. Will we get a recording of the exam? Yes, we will get a recording of the exam. Have I made myself clear? Yes or no? Yes, okay, so one more time for all the students who are listening to the recording. If you guys have sat for the exam, and you guys did not pass, then a bigger congratulations to you, because you guys will go through the text by yourself one more time, especially the cardiac embryology, anatomy, and physiology, and then you guys will do well. Okay, let me address Dr. S. I'm not very well versed about Valsalva outputs. There is some confusion. Yes, Dr. S, please ask us your questions and we will clear your confusions. What questions do you have, or what confusions do you have about Valsalva? Do you want me to talk about Valsalva as a whole? Do you want me to talk about Valsalva as a whole? Yes or no? Yes, please. Okay. So very quickly over here, let's just review the Valsalva maneuver. Okay. Let's just review the Valsalva maneuver. The Valsalva maneuver has two phases. Number one is strain phase. Another one is a let go phase, right? Where we let go and relax. So what is Valsalva? Valsalva is the procedure of, for example, this is the lungs, right? This is the respiratory tract. The Valsalva is the procedure where we breathe the air and we keep the air in the lungs and we close the vocal cords. This allows the diaphragm to contract and push down and bear down. This is called Valsalva maneuver, right? We usually perform this kind of maneuvers if we're picking up a heavy object, number one, or if we are, for example, during coughing, during defecation, or during any other straining procedure, we would like to do this. The thing is, as a result, not only humans, as mammals as a whole, they have a tendency of, when they're performing a very difficult or a task where they need some strength, they like to contract their abdominal muscles, because this contractions of the abdominal muscle, this basically stabilizes their core, stabilizes the core. Does anyone have any experience of working out in the gym or anything else? Yes or no? Does anyone work out or tries to maintain some sort of a healthy lifestyle by going to the gym or something? Yes? Yes or no? Okay, let's assume the answer is no. Okay. If you were to go and work out in the gym, when you would lift weight, wouldn't you want your entire core to be strong? Yes or no? So that when you lift the weight, it's easy for you, because if your core was not strong, then would you be able to stabilize your body? Yes or no? The answer is no. If your core was not strong, then you would not be able to stabilize your body. Next thing is, if you could not perform this maneuver during constipation, can a patient get rid of the hard feces? Yes or no? The answer is no, because they cannot bear down. Or during delivery of a baby, can a mother push down on the uterus if they cannot do the Valsalva? Yes or no? The answer is no. So different processes in our day-to-day life, we use Valsalva without even knowing. Okay, so this is what the Valsalva maneuver is. Now let's talk about how the Valsalva maneuver affects cardiac outputs and everything else. So in the strain phase, when we are straining, we put pressure, and what it does is that it increases the overall intrathoracic pressure. It increases the overall intrathoracic pressure in the straining phase. If the intrathoracic pressure is increased and we have the heart over here, is the pressure over here afterload, is it high or is it low? The answer is the afterload is high, increase of afterload. That's number one. Number two, the blood that's coming back to the heart, is it high or is it low? The answer is it's high. So preload is also increased. How? Because when we take a deep breath in, all the vessels, they sort of constrict and this pushes the blood into the left atrium. So that's it. And next one is when afterload and preload are increased, there will be increase of some murmurs. If a patient has atrial regurgitation, mitral regurgitation, or a ventricular septal defect, all of these things will increase the blood inside the heart, and this will increase the murmur intensity. Similarly, the murmurs that are dependent on low blood volume, for example, mitral valve prolapse and HOCM, the murmur intensity of these ones will decrease and these ones will increase because of high amount of blood. The murmur intensity of these ones will decrease and these ones will increase. Okay, so I'm repeating myself twice. Let's move forward to the next one. The next one is after you hold the breath for such a long time, are you going to let the breath go? Yes or no? The answer is yes. Okay. So when you go, when you let the breath go, will there be a sudden fall of the intrathoracic pressure? The answer is yes. When there's a sudden fall of intrathoracic pressure, will there be a sudden decrease of the afterload? Yes or no? The answer is yes. So afterload will decrease because the intrathoracic pressure is decreased. And when afterload is decreased in the let go phase, and all the blood they leave the heart, can the murmur intensities for these two conditions, can they reverse? Yes or no? This one will then increase and this one can get decreased. Are we clear now about the Valsalva maneuver? Yes. Does anyone else have any question? Okay, someone talked about the membrane action potential. Straining should increase MVP and your whole, yes, basically, okay. So basically whenever we strain, what happens? Whenever we strain, do we have a high amount of blood in the heart? Yes or no? During the straining phase, do we have a high amount of blood in the heart? Yes, if there's a high amount of blood in the heart, what would happen to the murmur intensity of mitral valve prolapse and of HOCM? Decrease. Exactly. Okay. Okay. Sometimes over here, the preload can increase for a transient amount, and then in the straining phase, the preload will also decrease later because the vessels are constricted, so vasoconstriction. So that's it. Okay, so that's basically what it is. Next one is someone asked me a question regarding the membrane action potential. So there are two membrane action potential, one in the cardiac myocytes, another one in the pacemaker. The cardiac myocyte membrane action potential is that it starts from a resting membrane of -85. Then there's opening of the voltage gated sodium channels. Then the opening closes and potassium channel opens. As a result, we have a fall. And then the calcium channels open, and then the potassium and calcium are working in the opposite direction, for which there is something like this over here, which allows the heart to fill up with blood and contract. And after contraction, what happens? The calcium channel closes and the potassium channel opens. As a result, the membrane is repolarized. Then let's talk about the pacemaker action potential. There's an opening of the funny sodium current channels, which results into something like this. As a result, the sodium channels, they come inside, and when they come inside, there's a sudden depolarization. Yes or no? What is the name of this phase? Can anyone tell me the name of this phase? The name of this phase is, it starts from phase 4 over here, and then this phase is called phase 0. Okay, and then all of a sudden, what happens? The sodium channels close, the potassium channel opens, and then we have a sudden fall like this. This is phase 3. Okay. Are we clear? Yes or no? Okay. Does anyone know who Inamullah Khan is? Is this any one of you guys or any one of your friends or anyone who's using a different name to enter the lecture? Okay. So I guess not. So that's it. Okay, so with that being said, are we clear about today's cardiovascular questions? Yes or no? Everyone? Can you ask a few questions about murmur exaggerations or decrease with different maneuvers? Okay, so let's do this. Murmurs. Let's talk about this. The Valsalva maneuver will increase what murmur? Fast answers, please. Everyone, the Valsalva maneuver will increase which murmurs? Increase, increase, increase. They will increase which murmur? Okay, so during the strain phase, the murmurs, okay, during the strain phase, what will happen? And during the let go phase, what will happen? Okay, I think you guys are still confused about the murmur intensities. Okay, so during the strain phase, during the straining phase, what's happening? And during the let go phase, what's happening? Okay, let me say this one more time. During the strain phase, we have increase of afterload and decrease of preload. As a result, the amount of blood that's coming inside the heart. Okay, let me repeat myself. I'm not sure if I'm causing the confusion or if you guys are going to be causing the confusion, but let me do this one more time. During the strain phase, when we are straining, the amount of blood that's coming inside the heart, is it high or low? Because of all the intrathoracic pressure, is it high or low during the strain phase? Low, low. If it's low, then what would happen to the murmur intensities of Hocum? Okay, so during the strain phase, the murmur intensity of Hocum and mitral valve prolapse will increase. Okay. Okay. And during the let go phase, the preload will increase and Hocum and mitral valve prolapse murmur will decrease and AR, MR, and VSD murmurs will increase. Okay. Are we clear? Yes or no? Okay. So one more time. In the Valsalva maneuver, in the strain phase, which murmurs will increase? In the Valsalva maneuver, in the straining phase, which murmur will increase? Hocum and mitral valve prolapse. Very good. In the let go phase, which murmurs will increase of Valsalva maneuver? Very good. In passive leg raise, which murmurs will decrease? In passive leg raise, which murmurs will decrease? Very good. In increase of hand grip, which murmurs will increase? In increase of hand grip, which murmurs will increase? Very good. An increase of inspiration, which murmurs will increase? Okay. Last discussion. Either you remember this. The easiest way you can remember this is maneuvers, okay, and murmurs. Look, if there's, you guys did really well. I'm just giving you another pointer. If there's any murmur that increases blood in heart, anything that increases the blood in the heart, this will increase the murmur of AR, MR, and VSD, and decrease the murmur of Hocum and mitral valve prolapse. Vice versa, if there is decreased blood in heart for whichever maneuver, then there will be decrease of the murmur of AR, MR, and VSD, and increase of Hocum and mitral valve prolapse. Are we clear? Yes or no, everyone? Okay, so next time, if you guys are confused, ask yourself, is this increasing the blood in the heart or is this decreasing the blood in the heart? As simple as that. If any maneuver, according to your concept, increases the blood in the heart, then these are the murmurs that would increase. These are the murmurs that will decrease. If any concept that you believe will decrease the blood flow in the heart, will decrease the murmur and increase the murmur of Hocum and mitral valve prolapse. Okay. Is this better? Yes. Okay, good. So that's that. Now, most of you guys have passed your exams. Congratulations are in order. Does anyone else need any other explanation? Yes or no? Does anyone else need any other explanation? Can I get a no in the chat box from the students so that I know that I can move forward? No, okay, good. So we have, are we done with today's exam? Yes or no? The answer is, unfortunately, the answer is no. Why? Because what else do we have? What else do we have? We have an exam on endocrinology, okay? So let's take a break for 15 minutes and then let's come back and let's do endocrinology questions. Are we clear? Okay, so thank you so much. Good job. Let's take a break for 15 minutes. Let's come back and let's do endocrinology questions. And then we'll end the lecture for today. And next week, we will finish the cardiovascular system. And okay, so I need some feedbacks from you guys regarding the next system. Okay, regarding the next system, which we will begin next week, mid next week. Now, the next one that I want to begin is either GIT or reproductive. Which one do you guys want to do? Now, keep in mind, reproductive is very big compared to GIT. So which one do you guys want to begin? Can I get some feedbacks over here? Can I get some voting? Okay, just give me 1 second. Reproductive for how many? Let me see. So 1, 2, 3, 4. 4 and GIT for 1, 2, 3. 1, 2, 3. Okay, so reproductive is the winner. Okay, so then reproductive. Now, so next week around Tuesday or Wednesday, we will begin with the reproductive system. Are we clear? Yes or no? Okay, so that's that. Thank you so much. Let's take a break for 15 minutes. Let's come back and let's prepare ourselves for the next phase of the exam. So I'll see you guys at exactly 12:11 p.m. Okay, thank you so much. Okay, is everyone ready? Yes or no? Okay, so I'm going to mute myself and then we'll begin the 15 question test. Okay, can I get some feedback from the rest of the students? Dr. Ellen is ready, Dr. Dahlia is ready, Dr. S is ready, Dr. Fidel is ready, Dr. Ethan is ready. Who else is here? Are we ready? Yes or no? Everyone else? Perfect. So same way, let's begin. Okay, is everyone done with the exam? Yes or no? Can you guys hear my voice? Okay, just give me 1 second. Okay, so are we ready for the first question? Yes or no? Okay, let's begin with the first question, see what it is. Okay, so an investigator studying bone metabolism and compared to serum studies of a cohort of women 25 to 35 years of age. Which of the following process is most likely to be increased? Which one did you guys choose? Fast answers, please. Very good. Let's move forward. Which of the following is the most appropriate next step in the management of the management to prevent cardiovascular disease in this patient? Which one did you guys choose? Very good. Decreased production of which of the following is the most likely underlying cause of these patients' current condition? Which one did you guys choose? Okay. Weird how all the answers are A, right? Okay, let's move forward. Which of the following enzyme can contribute to maintaining a normal serum glucose level in this patient? Phosphoenol pyruvate carboxykinase. The answer is phosphoenol pyruvate carboxykinase because this is an enzyme of the gluconeogenetic pathway. Okay, so this is something which we have not discussed as of yet. Okay, so that's that. Now, from over here, there are two answer options that are correct. That is A, phosphoenol pyruvate carboxykinase. This is correct. And number C, that is glycogen phosphorylase. These two are correct. Now, please put your attention over here in the question, which says, which of the following enzymes contributes most? Most. The answer is most. Okay. The question is most. So most, when they say most, they're asking you to rank in terms of 1, 2. So if I had to rank in between these two enzymes, phosphoenol pyruvate or carboxykinase or glycogen phosphorylase, the answer is I would choose phosphoenol pyruvate carboxykinase because this is very active and yes, very good, 36 hours of starvation. So that's that. So when they are starving for 36 hours, do you realize, first and foremost, is it easy to break down molecule or is it easy to synthesize a molecule? Fast answers, please. It's easy to break down a molecule. Very good. So which one of the process, glycogenolysis and gluconeogenesis, which one will happen first? Fast answers, please. The answer is glycogenolysis will happen first. So since this patient has been on a hunger strike for 36 hours already, okay, for 36 hours already, then this means that this patient has, this means that this patient has already depleted their glycogen stores, right? So that's why over here, the glycogen phosphorylase is depleted and phosphoenol pyruvate is the main option. Just give me 1 second, please. Are we clear about this question? Yes or no? Yes, okay. 1 second, please. My apologies. 1 quick second. Okay, so if I were to ask you a question, if I were to rephrase this question, and let's say I asked you, in between glycogen phosphorylase and phosphoenol pyruvate carboxykinase, which of these following enzymes acted first? If that's the thing, then which one would be the correct answer? Press answers, please. There you go. Okay, 1 second. Just give me 1 second. Okay, can you guys see my screen? Yes or no? Okay, can you guys see the question screen? Yes or no? Oh, good. Okay, let's begin. Next one. Which one did you guys choose for this one? Very good. Okay, let's move on. Which one did you guys choose for this one? Past answers, please. Okay, very good. Let's move on to the next one. Which one did you guys choose for this one? Very good. Congratulations. Which one did you guys choose for this answer? For this question. My apologies for this question. Okay. Ghrelin stimulation. Okay. Next one. Which one did you guys choose for this answer? Okay. Over here, this patient is a patient of what? This patient is a patient of Cushing syndrome. Yes or no? Okay. So what type of Cushing syndrome do you think this patient has? Can anyone tell me? Primary, secondary, or tertiary? If this patient already is taking prednisone from outside, will this not cause atrophy of the normal hypothalamus? Yes or no? That's secreting the releasing hormones. Okay. So this was a pretty easy question if you thought of this, right? Is this primary Cushing syndrome or secondary? Is this primary corticosteroid? This is not good. This is not primary or secondary. This is tertiary because of the administration of the steroid from outside. This resulted in atrophy. Which one did you guys choose for this answer? Okay. So this patient has tremor, diarrhea, weight loss, and protrusion of the eyeball. So what does this mean? The patient decides to undergo treatment, the successive treatment of. So which treatment are they talking about over here? Are they talking about radioactive iodine administration? Yes or no? Yes. Okay. So the radioactive iodine administration over here, in order for them to work, do they have to cross the membrane or not? The answer is yes. Okay. Okay. Which did you guys choose for this answer? Very good. Which one did you guys choose for this answer? G. Very good. We talked about this. Did we talk about this question before by any chance? Yes. Okay. What does it say when a question is repeated multiple times? What does this say about the question? Very good. Which of the following is the most likely predisposing factor? Which one did you guys choose? What's your answer, please? This is C, a high caloric diet. The question is, which of the following is the most likely predisposing factor? Over here, the correct answer will never be a disease that's related to ethnicity. Have I made myself clear? Okay. Yes or no? It could be related to either if it's a male or a female, obese or not obese, but not to an entire ethnicity of people. So that's why B is obviously not the correct answer. And in the future, please refrain from making the proper, please refrain from choosing ethnical based questions because, excuse me, because questions where ethnicity comes up as an answer options, very rarely do they ever come true. Okay, have I made myself clear? So on the other hand, when you're talking about diabetes mellitus, please think about a high caloric diet. When there's a high caloric diet, there's a higher chance of getting resistant to insulin. So that's why patients will develop type 2 diabetes. Okay, next one. Which of the following is the most underlying cause? Which one did you guys choose for this one? Very good. Arrested endodermal migration from the pharyngeal floor. What does this mean? What does this show? This show that there is a thyroid gland? There's a thyroid cyst, yes or no, in the patient? Yes, okay. So we all know what is the embryological background of having a thyroid gland, a thyroid cyst that's still there. Yes, so the answer is arrested migration from the pharyngeal floor. So it did not go down, it stayed in the tongue area. This is an ectopic thyroid gland. Okay, especially what type of a thyroid gland is this? Is this lingual thyroid by any chance? Yes or no? Okay, let's move forward to the last question. Which one did you guys choose? The answer is C. This is 17 alpha hydroxylase deficiency. So this patient is a 10 weeks gestation, a male patient who shows female genitalia. That means that there is absolutely no development of androgens, yes or no? The answer is yes, right? So as a result, shouldn't there be increased activity of aldosterone? Shouldn't there be increased activity of aldosterone and decreased activity of cortisol? Yes or no? Because do we need 17 alpha hydroxylase for the production of cortisol? Yes? Okay. So that's it. Have you guys understood all we have just discussed? Okay. From what I believe, do you guys realize the fact that we are solving so many endocrine questions? I personally have noticed a significant progress in your question solving skills and in your skills of recalling information. Do you guys see that in yourself? Yes or no? Do you guys see the progress? Do you guys notice the progress, right? So it's only been 1 week of our subscribed lectures. And once again, the reason for joining the subscribed lecture is so that I can provide you my undivided attention. And the best feeling in the world as a guider, as a tutor, and as a mentor is when your hard work pays off by seeing that the students are actually learning and trying to retain your information. And for that, I thank you. I thank you so much. Okay, and I really appreciate your effort. So today, for the 15 questions which we did for now, if you scored anything above 7 or more, then you pass. So can I please know your results? Anything above 7 is a pass. 7 or more. 7 or more. 7 or more. Dr. Ethar, congratulations with 14 questions. 11, congratulations. Dr. Allen, congratulations. Dr. Chaudhary, thank you so much. Congratulations. Dr. Tasneem, congratulations. Dr. VK, very good. Congratulations. Who else? Okay. Dr. Jorge, congratulations. Who else? Okay. For the rest of the students who also sat for the exam, and for the students who will be sitting or who has already sat for the exam while they're listening to the recordings, if you have passed, congratulations. If you have not passed, then by now it's high time that you realize that you are weak. I do not like to use the term weak, but it's a fair term. I'm going to tell you why. Because if you know your weakness, then you can work on them, right? Then I would say that if by now, if you're not passing your endocrine exam, then please consider endocrine to be a subject in which you're weak at. So weak in endocrine. So that means that you have to actively work more on endocrinology. How? Revision, recapitulation, and execution of your knowledge. Number one is read first aid again. Number two, please do UWorld endocrine questions every day, minimum of 20. This goes for everyone who have not passed and for everyone who is listening to the recording. And if you haven't passed an endocrine exam by now, then this is high time that you realize that this is your weakness. And please, I insist you start working on them. Have I made myself clear? Yes or no? Everyone? Okay, good. So with that being said, we're done with the lecture for today and we're done with our week. Very big congratulations to everyone for putting their utmost effort. Throughout this week, I have tried my best to conduct the classes in a given time. The reason why for today and yesterday, there was a little bit of discrepancy regarding the timing is because of some personal problems in front of our house where the roads are being constructed. And the noise in the early morning is extremely distracting for me to take a class with. So I had to wait for the noise to get over in order for me to conduct the class. So I apologize for making you guys wait for an hour, but I'm glad that we're done for the task for today. Repeat question 9, the answer is B, okay? Patient is taking steroid from outside. This is causing atrophy of the hypothalamus. As a result, patient has tertiary cause of Cushing syndrome. Okay, are we clear, yes or no? Okay, tertiary adrenal insufficiency, my apologies, not tertiary Cushing syndrome. I keep on saying tertiary Cushing syndrome. There's no such thing called tertiary Cushing syndrome, tertiary adrenal insufficiency. Okay, does anyone else have any more questions? Okay, can I get the attention of Dr. Fidel? Do I have Dr. Fidel with us today? Okay, Dr. Fidel, I think he had some questions. I think he's not here anymore. Okay, so if that's all, does anyone else have any other question for me? Yes or no? If no, then can I get a no in the chat box? Okay, no. So homework, what are your homeworks for next week, Monday? Oh, next week, Monday, next week is going to be a short week. I just want to tell you guys very quickly right away. The reason being is because next week we have Christmas Eve on Friday and on Saturday we have Christmas. So the class for next week, Friday is suspended. Okay, so whenever a class is suspended in our tutoring platform, since we know that over here, every class is important, even if it's a national holiday, we cancel or suspend the class, but we also make it up, okay? So we also make it up. We also make up the class. So we will take another class to make up for the lost class for next week, Friday. Have I made myself clear? Can I get a yes or no? Okay. So next week, Friday, no class. When I say no class, what does that mean? That means no assessment. Okay, no assessment for next week, but we'll try to do a little bit of assessments every day, more or less. But the thing is, yes, since next week is a holiday, so no assessments, no stress, nothing. I just want you guys to relax and learn and sort of go with a very steady, nice, and easy flow. But having said that, next, so can you guys hear me now? Yes or no? right, so no assessment on next week, Friday. What I was saying before I got interrupted by the ambulance is that we'll have an assessment on 23rd, my apologies, 30th December. Okay. 30th December, and it will be on a Thursday. Okay, we'll have an assessment on a Thursday, 30th December. If anyone who is listening to the recording, I need you guys to be present on the 30th December if you can for the assessment. And for everyone who is here, I need you guys to prepare for the 30th December Thursday exam. Most probably this will be regarding CVS, endocrine, reproductive, basically more focused on CVS because we will incorporate CVS pathology and pharmacology, which are very, very high yield. So I highly, highly suggest you get on with solving the questions and reading the first aid every day. Next thing is, this is the next announcement, that is your homework. For your homework, this for Saturday and Sunday, do you guys do the homeworks or do I just give them out and it just goes away unnoticed? Because if you guys do not do the homeworks, I'm not going to give you guys homeworks. Okay, good. Okay, good. Thank you so much. I appreciate that. Okay, so your homeworks. Number 1 is Patoma. All you have to do is basically just sit back, relax, and watch the video of Patoma. That's all you have to do. Watch the Patoma videos. That's all for endocrine and CVS. Number 2, Saturday, that's tomorrow, do 20 questions, miscellaneous from endo and CVS. Sunday, do 20 questions from the same thing. And for Patoma, both days, Saturday and Sunday. Have I made myself clear, yes or no? No lecture on 24, 25, 26. 24 is Friday, 25 and 26 are weekends. So that goes without saying that the classes are not going to take place on a weekend regardless. Okay, so we're only taking one day off. 25 and 26 are Saturdays and Sundays. So that's that. Okay. Any other question? Okay. 20 UL question, CVS and endocrine. Okay. Okay. So over here, you guys should be really, really proud of yourself for all the hard work that you have put in throughout the whole last week. And I personally am very, very happy with this batch of students, as I was with all the previous batches. You guys are very hardworking. I need you guys to focus and believe in yourself and know that step 1 is only a little small obstacle in your entire US medical journey. Okay, so please try to relax while you study so that your information will be grasped a little bit easier. If you ever have any questions and you are in seek of guidance, please do not fail or hesitate to reach out to us, and we will help you out. And with that being said, if all is well, then I wish you guys a very, very happy weekend and a happy Friday. Make sure to spend some time with your friends and family, and I'll see you guys on Monday at 9:30 a.m. Okay, so bye-bye and thank you so much. Hope you guys have a great rest of your day. Okay, bye-bye. Thank you so much.